Hello, I'm Dr. Douglas Bull. I'm an ophthalmologist here at Reedsburg Area Medical Center. Today I'll talk to you about glaucoma. Glaucoma is a group of diseases that cause progressive loss of vision over time. It's a very common condition that we see in our office every day. Glaucoma can be separated into two primary categories, one being primary open-angle glaucoma and the other is angle closure glaucoma. There are also other ways to classify glaucoma, but the takeaway is that there are essentially more than one type of glaucoma. The vast majority of people have something called primary open-angle glaucoma. And that's a problem that we experience as we age sometimes. People can develop primary open-angle glaucoma because of the drainage system in the eye becomes less efficient at draining fluid in the front chamber of the eye. So the areas that do drain the fluid that's produced inside of the eye can become more narrowed, and this can lead to an elevated intraocular pressure. So at the time when people come in for a visit, we always will check your eye pressure. And that's the reason we do that, again, is because that helps to determine if the pressure is elevated. The pressure being elevated is not by itself the cause of glaucoma. It can be a secondary effect. Some people actually do have normal intraocular pressures and still have glaucoma, and that's called normal pressure or normal tension glaucoma. So it's more than just checking a pressure. So in addition, at the time of exam, we perform a dilated exam to look actually at the optic nerve. The optic nerve is all the nerves collected from the retina nerve cells, and they form a cable that goes out the back of your eye, and then about 52% stay across through your optic chiasm from each eye, and 48% stay on the same side. And then they travel back to the back of your brain, your occipital lobe, and that's where your vision center is. So it's basically the computer cable from your computer to your monitor that allows you to have vision. That optic nerve can be damaged. Some theories are that there is mechanical compression of the optic nerve from an elevated pressure. Other thoughts are that there's a lower amount of blood supply that occurs in some individuals, and that can also cause damage to the nerve cells. As you know, nerve cells are very sensitive to a lack of oxygen. If you have been underwater and are without air and your blood oxygen levels go down, you can die after 4 to 5 minutes of lack of oxygen to your brain. And your brain is essentially made up of nerve cells. And consequently, the same applies to the optic nerve. When there's a chronic kind of low-grade pressure elevation, damage can occur very slowly. Glaucoma is often called the silent thief of vision because it's something that you're not going to have symptoms from many times. By the time people have visual loss or peripheral visual loss, they often have had at least 35 to 40% damage to the retinal nerve cells inside of their eye in their retina. So our goal for examination is to pick up on any kind of early signs at a very early stage so that we can begin treatment so that glaucoma can be halted to a slower rate. We never really cure glaucoma completely. So the goal is to begin treatment such that the glaucoma is slowed to a point that it really should never cause any further damage. Glaucoma is a process, unfortunately, that does vary amongst different people. Age is one of the biggest risk factors for development of glaucoma, especially over age 60. Everyone should have a yearly checkup to check their pressure and have a baseline evaluation of their optic nerve. If you have a family history of glaucoma, we recommend beginning yearly examinations at age 40 because family history does have a higher incidence of people developing glaucoma during their lifetime. If you develop that at an earlier age, then there is a longer period of time potentially for glaucoma to cause more severe damage if left untreated. Other risk factors are males have a greater risk of developing glaucoma, different races, ethnicity, people of African descent, Asian descent, Hispanic descent have a higher incidence of developing glaucoma as well. Certain medications such as use of topical, oral, or injected steroids can all increase your risk of developing what's called steroid-induced glaucoma. Certain conditions can also increase your risk of glaucoma, such as systemic conditions or congenital conditions. So it's very important to come in as an ophthalmologist. I evaluate the totality of all the different things that we're considering that we just talked about, your ethnicity, age, race, the different medical conditions you have, different medications you're on, in addition to performing an examination. And that is how we determine if there is indeed glaucoma or there's suspicion of glaucoma developing in the future.